patient is in your chair, it's a child, you check his entire facial analysis, you start to have a little doubt, open his mouth with a wooden spatula, with a tongue depressor, and start to think, good Lord, should I or should I not do this intercept orthodontics treatment? Is it worth it or not? So, if you have already been through this situation, stay calm because today we are going to talk about the 10 signs, the 10 characteristics that make it necessary to treat with intercept orthodontics no matter what, so you won't have any more doubts. I will also show you characteristic photos so you can memorize and learn and have no more doubts when you arrive at the consultation. Stay in the video with me. Loves, welcome everyone to our YouTube channel. If you are new here, welcome. If you are a veteran of the channel, welcome back home. This channel is yours. Before we start with everything, I made some organization of photos to show you. I want to ask appliance that you leave a like on this video, and if you leave a like on the video, it helps us show more and more doctors that this content is valuable. So leave a like, subscribe to the channel as well to receive other updates, because every week we have a new video here. Also take the opportunity to share this content with your friends who also like to learn about intercept orthodontics. I made this video especially for many doctors who send me messages with photos of a clinical case saying, "Doctor,
is it necessary to treat this clinical case? Do I need to put an appliance on this patient?"
We organized these 10 signs that indicate you definitely need to treat. First sign. The first point I bring to you is mouth breathing. So, we need to observe very carefully the breathing of children and young patients, because often when they are small, they are still in the process of maturing. This breathing, we conduct an initial analysis, which would be the analysis of evaluating the patient's profile and the relationship of the lips. So, from the moment we observe that the patient does not seal the lip in a passive way, it already concerns us a bit. But then we move to another level, evaluating if this patient has any problem related to lip tonicity. So if it's a muscular problem, or if it's a problem related to the airways, or if this patient has a problem related to the intraoral area. So there can be these problems, and when it's related to appliance of intraoral relationship, or then airways, intercept orthodontic can help. We even have many scientific studies that show that rapid maxillary expansion, for example, ends up increasing the airways at the nasopharyngeal level. It's oral breathing, a sign that we evaluate, and if the patient presents oral breathing, we should already implement the intercept orthodontics protocol to at least act in a multidisciplinary manner and evaluate more precisely if this patient will require treatment. Our second sign that a patient needs intercept orthodontics is related to growth anomalies. If you evaluate this profile, you will find videos discussing facial patterns and how important it is to know what the facial patterns are. But our second sign that treatment is necessary is if this patient has growth anomalies in the sense of having mandibular prognathism. If the patient presents, you do a facial analysis and observe that the patient has a slightly straight profile that is already decisive for treatment in a child. It's what I always do. If you see a child with a straight profile and a prominent chin, if you find this child in the supermarket, you should take the child to the consultation because the treatment is urgent. So, observe here a pattern 3 patient. What is the profile of this pattern 3 patient like? They have a prominent chin. The lower lip is ahead of the upper lip. We observe a shallow labial groove. We see this profile, which is a straight concave profile. This one here is already concave. So this is very concerning, and it is necessary to treat with Intercept Orthodontics. Let's move to our third sign that it is necessary to treat with Intercept Orthodontics. It would also be a growth anomaly, but in reverse, which would be the treatment for pattern 2. So if the patient you observe is a patient who presents either mandibular retrognathusm or maxillary protrusion and has a very convex profile, and you notice that often this patient has a significantly retruded chin because 75% of pattern 2 patients have this retruded chin, which means they will have this representation, so they will have characteristics similar to this line that I am showing you. So, it is a sign to treat with Intercept Orthodontics. Our fourth sign and our sign number 5 are also related to growth anomalies in this vertical sense. So, patients who grow very little in the vertical sense, who are extremely brachyfacial, need treatment. So, observe here the short-faced patient. This short-faced patient who has a very reduced lower third of the face and an extremely large deep bite. It's not the same. It's a very severe deep bite already with where on the incisal edges of the lower incisors, often fractures in these lower incisors, we perform Intercept Orthodontics treatment with the aim of increasing this lower facial height, that is, to help this patient better develop the lower third of the face and naturally improve the deep bite. But it's only for patients who are extreme, considered short face. And now we move on to our next sign, our next signal, which would be the long face patients, which would be the exaggerated dolichofacial type, like this girl. You see here, that lower third of the face is very increased. You see, there's no sign of lip, and this is a patient who, if she grows, will possibly require surgery. The cases I have shown you so far, the long face is the one we have the least control over in terms of growth, but also many times we manage to perform some types of treatment, nowadays associating with mini screws, but controlling the treatment of this long face patient is complicated. So these would be the signs that we observe on the patient's face. Mouth breathing, pattern 3, pattern 2, short face, long face. And there we have some signs related to occlusion. What would these characteristics be that you need to observe in the patient's occlusion to know that they need treatment? First of all, is our classic and wonderful box-lid relationship. Observe here that I have a box and I have a lid. Basically, it's the relationship we have between the maxilla and the mandible, so the maxilla should always encompass the mandible. Every time I have a patient with these characteristics where the maxilla does not encompass the mandible and the mandible ends up encompassing the maxilla, I have this inverted relationship. Notice that here I have this unilateral posterior crossbite, which means I need to treat it immediately. So if you have a patient like this, your consultation is immediate treatment. Why doesn't this posterior crossbite correct itself over time? They will not improve with growth. The patient actually only gets worse with this growth. So this is a sign that needs treatment. Continuing with the signs of occlusal characteristics, what we should observe is the anterior open bite. So every time a patient presents this anterior open bite relationship, it means that the upper and lower incisors will not be able to follow their natural eruption path. So it could be for some reason, it could be direct factors, which are the primary factors, or secondary factors. So it could be habits, or it could be respiratory factors, specific factors such as trauma, but in general, these incisors will not be able to reach their proper position, and this anterior open bite also needs to be treated. Because if I don't treat this null occlusion at this stage of childhood, when the permanent dentition arrives, it is much more difficult to treat. What we have in the literature is that anterior open bite in childhood in deciduous and mixed dentition is treated and there is stability in 99% of cases. Now, if I don't treat it and leave it to be treated later in permanent tension, the stability will drop to 65–70%. It is necessary to treat at this moment. Another sign that you should treat in intercept orthodontics is crowding. Observe this amount of crowding. This is considered genetic crowding of the patient. This crowding, besides not allowing the patient to clean their teeth well, when you observe a case like this in your consultation with a patient with crowding, you need to treat it no matter what, because this patient is in the development of adhesion. They are a mixed adhesion, exchanging teeth. And if there is already crowding at this moment, when not all the permanent teeth are in the mouth, imagine when they all arrive. Not to mention the possibility that these permanent teeth could become retained, like premolars and canines, if you don't perform a good serial extraction or a good expansionist treatment. So, crowding is very important. I would also like to mention another factor that is very important to address in intercept orthodontics, which would be retained or impacted teeth. In your practice, there might have been a patient who had an impacted tooth, and some dentist or odontologist, poor odontologist, without knowledge, went there and simply extracted this canine. Because many times people don't have the knowledge that. Evaluate well, and that's also why it's important that the first panoramic X-ray of an intercept orthodontics patient should occur between 5 and 6 years old, because the more we evaluate and can monitor these patients with X-rays, the better, as we can understand if at this stage of development the incisors have adhered, whether they are first molars, premolars, or canines, if these teeth follow the appropriate eruption path. So, observe here this case of a permanent canine that had an ectopic eruption path. It was observed in the X-ray that the canine was not following its natural eruption path. And why do I observe this? I saw here, on the right side, the canine is fine, positioned in the region near the apex of the lateral incisor. But on the other side, the left side, this canine erupted a while ago, so you can see that the canine is in the mouth. That is a sign that the canine was unable to bring and exfoliate the deciduous canine at its natural point, and that some action, some type of treatment, will be necessary. The first thing people think is, oh, I will extract the deciduous canine. But possibly that won't work, because very possibly this canine is actually in a region that is not in contact with this deciduous canine. And when we went to evaluate, indeed this canine was palatally positioned, as shown by the computed tomography we performed. In this case, the choice is to perform this treatment, which is super simple, involving a transpalatal bar associated with a traction cantilever, where initially I don't apply any traction, I will perform a vestibularization. And the advantage of the TMA cantilever is that I can achieve good flexibility to first vestibularize this canine and subsequently start the traction process. So you see that no bracket is necessary. I am still in the intercept orthodontics process, and only after I position this canine in the dental arch can I then proceed with corrective orthodontics treatment. Notice that there are many factors, many signs that indicate you need to perform intercept orthodontics. I couldn't make this video too long, so it wasn't possible to include all the signs that indicate the need for intercept orthodontics treatment. But if you are watching this video and thought of any sign that indicates the need for intercept orthodontics treatment, thank you. Please leave it in the comments. I would be delighted to read it. Or perhaps something your patient already has, which you still don't know how to treat with intercept orthodontics, but you identified that it needs to be treated. If you watched this video until the end and you were thinking, oh my God, I need to do a course or some studies in Intercept Orthodontics. Well, let me tell you that the best course in Intercept Orthodontics is the Intercept course. We have had this course for 4 years, and there are already more than 3,000 doctors graduated in the method. And if you want to receive information about this Intercept course in advance for our next group, because at the moment we are not officially open for registration, then if you want to receive information about the next group, take advantage. Now, to be part of the waiting list. Is that okay? I will leave the link to the list here. I hope you really enjoyed the video. If you liked it, leave a like, share with your friends, and we'll see you in the next video on the channel. See you next time.